right. Yes. Now, once again, before I start today, I'd like to send a shout out again to my beautiful girlfriend, Lorana. I love you, and I appreciate everything you do for me, and we will make it happen, baby. I appreciate your help and your guidance and your love. All right, my friends, it is time to start. You are watching Political Point Magazine. Where the right where the right is right, and the left is always on the wrong side of history. Why? Because political minds want to know. So enjoy a conservative point of view. And let's talk pea soup. With tonight's top stories. Well, the government is back open for business. Or is it? Really? We will tell you about the new deal. The new debt deal that Congress struck. All right. And also, Obamacare is a disaster. The website crashed and everything. And, people can't get on. We will tell you the dangerous side effects to the Affordable Care Act. And there are several people out there calling for the HHS Secretary, Health and Human Services Secretary, Kathleen Sebelius, to retire, to step down, because she botched up the health care thing. All right, and also, it's time for another conservative revolution. Okay, we will talk about the main players in this, okay, and talk about a brand new way to revitalize the GOP, the Republican Party, and put out a good message. And also, so let's get this fiscal house in order, and we will talk about this with you, the viewers. We'll take it to the phones, and all of this. All right, my friends, welcome to another edition of Political Point Magazine. I am your humble host, William Petro. My friends, the government is back open for business because Congress struck a new deal. That's right. Okay, Congress struck a new deal here. All right. Now, Congress moved late last Tuesday to avert the unprecedented U.S. debt default. Okay, and yeah, and hoping to end the 2-week political battle that ratified financial markets, okay, splintering the Republican Party and showcased Washington dysfunction. All right. Now, this, my friends, okay, what actually happened here? Now, they struck a new deal here, all right, which I think is quite the okay. So let's see. What happened here is they put things into perspective here, all right. What happened here? To avoid default, okay. The GOP, okay, in both houses, okay, agreed to raise the debt limit. Okay, get this, raised the debt limit. Okay, in other words, now the president can borrow more money and add to the deficit. Now, okay, and in return, in return, the government runs again. Okay, but only until no, only until sometime in February. Okay, the middle of January. January 15th is when we'll have another debt battle. Okay, and we'll have to go through this over again. All right. Now, so this deal, my friends, I'm kind of shaky on it because, you know, a lot of people are saying that the Republican Party now, or the Republicans, kind of retreated. Um, but I don't really see it that way. The GOP retreating. Okay. Now, I think it's time to stand on principle, and this is how we can revitalize the GOP. Okay, because I feel that the GOP now, the Republican Party now, is in a good position to win the expand their majorities in the House and retake the Senate in 2014. All right, but we are in a good position here. Okay, so now the government is back in business now, but or is it? Okay, but let me tell you about the new debt deal. Okay, as we put it here, and we need to get our fiscal house in order. All right, but apparently we can raise the debt limit now. All right, but that is until January 15th. Okay, so somewhere towards February now we will go through this again. Okay, and it seems to me like we just haven't learned. Okay, we just haven't learned. We keep borrowing and borrowing and spending this money needlessly, and the whole thing is quite shocking. Okay, in fact, let's review some of these things. Okay, now, but the government now is back in business, supposedly carrying out the people's business. Okay, carrying out the people's work. But now, okay, this, my friends, we need to revitalize. Okay, we need to get this debt down. $17 trillion in debt. You know, heading towards bankruptcy. All right, and the Obamacare thing. All right, so let me show you what Obama. Okay, let me show you what Obama has said. Okay, about the New Deal and everything here. All right. Okay, this is what Obama said. Okay, take a look at this.
There's been a lot of discussion lately of the politics of this shutdown. But let's be clear, there are no winners here. These last few weeks have inflicted completely unnecessary damage on our economy.
Really? Wait a second here. All right. Now, once again, it's the economy. All right. So, President Obama is blaming the Republicans for the shutdown and saying that it caused pain on the economy. But with all due respect, all right, your policies, Mr. President, have been are the reason why the economy is still stagnant. Okay, and a good part of the reason why the economy is still stagnant is Obamacare. All right, now the system crashed. Okay, and they reported now that only 37,000 people have actually managed to get on for the exchanges. All right, 37,000. That's ridiculously low, and the administration was predicting that everything would go according to plan and everything, but they admitted defeat. However, early when President Obama kept on making these exemptions and trying to change the law, you know, he waived the employer mandate, which is a defeat for the administration. The website wasn't even ready, okay, for prime time, okay. And I don't know a single soul around me that has managed to get on for the exchanges. Okay, this is why Obamacare is a disaster. Okay, everything is a disaster. All right. Okay, and it's costing us too much money. Okay, it's implemented by the IRS. Okay, which is our tax dollars. Okay, and for one, people are confused about Obamacare. Okay, people are really confused about Obamacare. Okay, this whole thing is a disaster. In fact, let me, okay, before I get to the dangerous side effects of the of Obamacare, all right, I want people to see this clip. Okay, while the government was shut down, okay, uh, um, rapper Nelly spoke out about the government shutdown. Okay, and I want to show you this clip. This is funny. All right. Okay, but I actually agree with Nelly on this. All right. All right. Okay. So take a look at this. All right. Okay. And so as we go into this, I want to show you this. Okay, because this is absolutely funny. All right. But actually, okay, before I get into that clip, okay, but the government is back in business, all right. Before I get into that clip, all right, I want to show you something. Okay, so the government is back in business. Okay, let's get this clip here, all right. But let me show you how the mainstream media on CNN tried to twist and attack the Republicans, a Republican congresswoman, for the shutdown. Okay, all right. So take a look at this. All right, take a look.
Comes to Obamacare, do you hate Obamacare more than you love your country?
I got to tell you something. I think that comments like that you are making are just incredibly inappropriate. What we have to realize
You don't think it's
is
incredibly
that the
inappropriate to shut down our government and to take
No,
all the
I said
hostages
your
of Americans that you've taken? No, it's not inappropriate
No,
because you've taken the
no.
government hostage
that
through a shutdown, and all the American people, you're now walking them to a cliff, the economy, and you're going to push them over one by one based on the fact that you don't like the ACA. That's all it is. You
Listen
don't
to
like the
yourself.
Affordable Care Act.
Listen to yourself. We didn't want a government shutdown. Just listen to the way you're sounding. My goodness.
Mm-hmm. Yep. That's right. The media's unfair treatment of the GOP over Obamacare and the shutdown, all right, is quite discouraging. Okay, quite displeasing because this, my friends, really shows the liberal bias in the media. Okay, they're biased against the Republicans. They're blaming the Republicans for the shutdown. Okay, and they claim, okay, they claim that this is all the Republicans' fault. But and we're holding the people hostage. All right, no, that's not the case. Okay, like I said before, it was the Democrats that shut down the government. Okay, because they didn't want to negotiate. It was the Republicans that were passing resolutions to fund every aspect of the government, but Obamacare. Okay, they wanted to keep the government running. They wanted to keep the government open, but the Democrats refused to work with the Republicans and negotiate. So thus, it was the Democrats that forced the government shutdown. All right. Okay. Now, on this note, okay, the government has now, okay, the government has now has an opportunity now to get back to business now over this shutdown. Okay. After the shutdown now. Okay, and now we have the Nelly clip. Okay, I actually agree with him on this. Take a listen to this one. Okay, take a listen to this. All right.
I'm trying to campaign since the government ain't working, we shouldn't have to pay taxes because, paying taxes is supposed to pay for the government, which in turn is not working. So if they're not working, I shouldn't have to pay taxes. And me being in the upper echelon of the tax bracket, feel that the money that I could be saving over these next couple of days could be very vital to my survival. That's how I feel about it.
I actually agree with the rapper there. Okay, with the artist there. Okay, but for one, I think actually that we need to pay less taxes. We are taxed enough. Okay, under this administration, we are taxed enough. Okay, we have too many taxes. Okay, and that's the other thing. On Obamacare raises our taxes. All right. So now I'm going to get into the dangerous side effects of the HCA, the Affordable Care Act. All right. And so this, my friends, is what we need to pay attention to. Okay. So let's talk about the exchanges for one. Okay. Now, the exchanges, okay, are a very vital part here. Okay. And on this note here, all right. Now the exchanges, okay. Now late on July 2nd, the Obama administration dropped a bombshell, despite frequent claims that the Affordable Care Act is on track, and the administration had to admit that it was delaying implementation on major provisions. Okay, the major provision, like I mentioned before, the employer mandate. Okay, that's one of the exemptions that Obama did, trying to change the law because it wasn't ready for prime time. All right, so the employers got a break, but the individuals still had to pay, still had to get on the exchanges or pay a fine. All right. So the administration delayed the employer mandate. Okay. But trying to avoid controversy that a formal press release would generate, the Department of the Treasury published a blog posting after business hours during a holiday weekend. The blog said certain reporting requirements imposed on businesses would be delayed a year, without mentioning that this also means that the employer mandate could not be enforced. Yep. So, but Bloomberg reports that whose story? Okay, that the fact was revealed by Bloomberg reporters whose story forced the administration to tell the half truth. Now the next item is okay, if you're able to now the question is, if I don't have coverage, can I get it? Okay, now this is fairly easy to get. Okay, one-stop shopping on is an easy online process without the barriers and complexity that characterize the insurance market today. Okay, now that's the image that of the healthcare reform that the president laid out. Okay, but that is not what the health insurance exchanges will be able to deliver. Okay, and as you saw they were supposed to be right on target on October 1st, and look what happened. The system crashed. Nobody could get on the system. All right, and so Obama was all hyping up this thing, and saying, oh, it's gonna be ready. It's gonna be all set up. Everybody's gonna get health insurance. Okay, and look what happened. The system crashed. Okay, nobody could get on the system on October 1st. Okay, so now by January we're gonna see the crumbling effects of this thing. Okay, because now, this actually forces forces a lot of people to go on Medicaid. All right, which Medicaid has a problem because it underpays hospitals and doctors. All right, and everything now, okay, is just crumbling down. This is the worst disaster, and it's affecting jobs too. All right, a lot of businesses are cutting back on their hours now, making it harder for them to hire people. All right, okay. So on the exchanges now, okay, this is on the exchanges now. If anybody can get on them, okay, it's really ridiculous, okay, because now on this note, okay, Obama is pointing fingers at everyone, okay, for this, okay. In fact, okay, let me show you, okay. So the second clippage here, all right, but now with this crashing down here, all right, we know that okay, we know that everything, okay, now purchasing health insurance, okay, can be really frustrating, okay, but for people trying to buy coverage on their own, okay, benefits, cost sharing requirements, including deductibles and copayments, access to specific doctors and other health care providers, and premiums all vary, okay, making comparisons difficult, okay. The ACA establishes exchanges that are supposed to help people purchase insurance, but what is essentially a buyer's service, the Expedia for travel, is not a new idea, okay. People might as well, okay, instead of going on the exchanges of Obamacare, you can go on ehealthinsurance.com, okay. Yeah, okay, that's just the easier way, all right, because Obamacare is just a disaster, okay. It's just crumbling down, not making a bit of headway here, all right, okay, not making a bit of headway here, and this, my friends, is just quite disturbing. All right. Now, let's talk about affordability. Okay. Now, the public relations battle over the cost of health insurance in the exchanges is the full roar. Okay. Now, state insurance commissioners and health insurance exchange boards, eager to prove to taxpayers that they are doing their jobs, okay, have announced that they will save consumers plenty of money, or at least not cost them too much more. Okay. Now, critics of the Affordable Care Act, Obamacare, are talking about how premiums are going up, okay, under Obamacare. Okay. Neither side of this debate over premiums can address affordability from the only perspective that matters, the consumers. Okay, premiums might be lower than expected by experts, but are they lower than expected by the people who are supposed to buy insurance? I don't think so. All right. Now, the claims the claims and counterclaims over exchange premiums in New York illustrate the problem, okay? On July 17th, 2013, Governor Andrew Cuomo announced that premiums offered on the exchange in 2014 would be 53% lower than premiums currently available on the individual markets, okay? Now, Elizabeth Benjamin, an official with the advocacy group Community Service Society of New York, said health insurance coverage has suddenly become affordable in New York. Really? Are you kidding me? Really? Where did this come from? Okay. Not really. Okay. So, because now, okay, Now, I wouldn't be too sure because New York has the most heavily regulated insurance market in the country. Okay, in 1993, the state adopted guaranteed issue, which prevents insurers from turning down anyone due to pre-existing conditions. A pure community rating, which requires that everyone purchase insurance on the open market pay exactly the same premium, okay, whether they are young or old, okay, healthy or sick, okay. Mandated benefits were expanded and cost reducing practices were limited. All right. Now, as a consequence, premiums soared. Insurers dropped out of the individual market, and people who had been able to buy their own insurance could no longer afford the cost. According to one estimate, 96% of individual health insurance market vanished within 5 years. By 2009, the average cost of individual coverage in New York was $6,630, okay? Nearly $1,500 higher than in neighboring Massachusetts, all right? And more than $3,600 greater than the national average, okay? All right? Now, with a record like that, okay, even a partial insurance reform would be able to reduce premiums, but that does not guarantee affordable coverage. All right? Now, okay, here's another full explanation, okay? An individual buying insurance next year in New York can expect to pay from $3,800 to $8,300 per year for a silver mid-level plan covering about 70% of the cost of health care for an average person, okay? Low-income persons will receive a subsidy which substantially reduces their cost annual income of reduces their cost of coverage. Okay, state regulators said that an individual with an annual income of $17,000 will pay about $55 per month or $660 a year for silver coverage, okay? A person with a $20,000 a year income will pay $85 per month or $1,020 a year, okay, for the year, okay? Now, the advocates and online premium calculators that back them up overlook an important fact, okay? A more expensive plan will cost you more whether or not you receive an exchange subsidy, all right? With a fixed subsidy that does not change depending on the cost of the health plan, consumers become cost conscious comparison shoppers, okay? Health plans try to attract customers. Have an incentive to offer better coverage and lower cost, and that promotes efficiency throughout the health system. This sound idea invariably draws hostile fire whenever Republicans who call it premium support propose it for Medicare. All right. Now, okay. Here's how it works under Obamacare. All right. Now the exchange subsidy is tied to the silver plan, offering the second lowest premium. In New York State, the plan is New York Fidelis, okay, with a monthly premium of $349.14. Okay, this example should not be taken as a criticism or endorsement of any specific plan. Okay, a consumer, let's call him Bill Johnson, all right, has an income of $17,000 and will pay $55 a month for that plan. With the remaining $294.14 paid by the exchange subsidy. Okay, but that plan is likely to have a restricted network and doctors and hospitals. So that's another thing that Obamacare is causing. Okay, the healthcare subsidy will cause doctor shortages, and you know, the places to go to get your treatment will be limited. Okay, under Obamacare. Okay, that's another dangerous side effects of Obamacare. Now, okay, assessing the penalties. Okay, here we go. Now, okay, all right. Will the uninsured, particularly those who are young and healthy, decide that buying health insurance makes sense for them? Okay, well, I don't know. Okay, now let's see. Okay, now one person says that adverse selection, the disproportionate enrollment of high cost, high risk individuals is the greatest threat facing the exchanges. Adverse selection drives up the cost of benefits, which increases the premiums that must be charged, and discourages enrollment not only by the young and healthy, but also anyone who is not eligible for an exchange subsidy. Okay, so in other words, okay, now define that if you don't okay, that is why the law mandates everyone buy insurance or face a penalty. All right, now but the penalty is far less than the cost of insurance. Even with the subsidy, next year, scofflaws are liable for a $95 penalty, or 1% of your income. Okay, so Mr. Johnson, who makes $17,000 a year, okay, will pay a penalty of $170, or just over 3 months of the subsidy premium insurance. Okay, now I'm not ready for calls just yet. Okay, I'm not ready for calls just yet, so hold up on the calls, because I want to get to a very important point here. All right, I want to get to a very important point. Okay, all right. Before I get to the calls, because this is very crucial. All right, now over this Obamacare fiasco. All right, there are several people out there calling for HHS Secretary Kathleen Sebelius to resign. Okay, to step down, because she definitely botched up the healthcare thing, and Obama now is offering a new proposal where people can actually call and talk to a live operator. All right, this, my friends, is quite ridiculous. All right, okay. Now, before I get to the callers, okay, one more thing. All right, a couple more things. Okay, it's time for a conservative revolution. Okay, now, and let me tell you it's time for a conservative revolution. Now, on that note, okay, we have the key players of the Republican Party in on this, okay, which is Rand Paul, Senator Ted Cruz, okay, Mike Lee, and Marco Rubio, okay. These main players and myself, okay, we are leading up a conservative revolution, okay, for 2014 and 2016, all right. So, and our platform is a limited government platform, just like it was in the 1990s with the conservative revolution, with the contract with America, and the Reagan Revolution. Okay, the Reagan conservative revolution. Okay, Reaganites know what I'm talking about. Okay, and now also the Tea Party movement which created another conservative revolution. Okay, which allowed conservative Republicans to actually regain control of the House and expand their majorities twice. And now in 2014, we have an opportunity with these key players here to lead another conservative revolution. This is our platform. Okay, limited government, less taxes. Okay, and more freedom. Okay, we need to abolish the IRS. Okay, and now also this is how we're going to do this here. Okay, we need to. It's time for another conservative revolution. Okay, now our main theme now, if we want this fiscal house in order here, we need to cut taxes and cut the deficits. Okay, and our main focus should be on spending, and not just any spending, but the means-tested spending that has gotten us into trouble. All right. Now, our cuts that we should be focusing on, okay, is no new spending. Okay. Now we need to cut Medicaid, not Medicare. Okay. Cut food stamps, not Social Security. Okay. Cut disability insurance, not veterans benefits. Okay. Those are the cuts that we need to focus on. Okay. And then we need to get this debt down, okay, reduced and eliminated entirely. Okay. Then we can, if we focus on those cuts, we will be able to get this done. Okay. We will be able to get this done. Okay. Now, on that note, my friends, okay, it is past time for the phones. Okay. So now I am going to open it up to the phones. Okay. 272-3835 is the number. Monday, 21st of October. All right. Okay. Hello, you're on the air. What's on your political mind?
Yeah, well, I'm all for, like, Social Security continuing.
Yes.
I'm all for the Veterans Administration continuing.
Yes.
I'm all for laborers making it, but who signed the
Don't forget about the
Party?
old folks and the Medicare. Okay?
Okay.
We need to keep
Medicare,
that too.
let me explain to you. Social Security is $1,000, and then they pay a deduction when you have Social Security for Medicare. Did you know that?
But it's over $1 trillion of unfunded liability.
Okay, hold on. So you get the $1,000, and then you get reduced to $781, the average paycheck. And then from that, if you're disabled, you get lessened when you live with people. So the rules and regulations are informal at this point. Another thing I want to say is, what about the guy that didn't want the taxes raised? He signed signatures with every Republican. What about the corporations that laborers
you're
are
talking
working?
you're talking about the deal, the promise that the
promise of
the Republicans made.
No taxation, right?
No raising taxes. Yeah.
Right.
No raising taxes.
But what about the corporations that are tax-free, okay? What about the? I just watched 60 Minutes. What about the campaign money that's tax free, and then they put up like $1,000 of their own money, claiming that they can't have it. They had nothing coming in, and then they charged the campaign revenue service 18% interest. See, we have a treasury that's corrupt here, and it needs to be solved here.
Jack Lew is the Treasury Secretary now, and
Okay.
it's just a disaster now.
Okay.
You know,
A lot of stuff went down in New York, and people are being subpoenaed. But is it going to return to the actual budget for what these entities are being paid for through grants and stuff?
Interestingly enough, Paul Ryan and a Democrat now are coming up with a bipartisan solution for the budget deal.
Okay.
And
Another thing I want to say is, if we lose FICA for the laboring through taking away the taxes and everything, we're going to end up a junk bond America.
we're going
What's
bankrupt.
going to be? I'm all for getting rid of spending,
Yes.
but what about the laborers that have worked at minimum wage guidelines and paid into the system, and then their promissories are being revoked here?
Yes, well, we need to fix the system. We need to reform Social Security because
I agree.
it's going bankrupt.
Another thing is Medicaid coast to coast, okay? We all know that you go to the hospital, they give you medication, and then they want to bill the insurance outrate. This is another thing on 60 Minutes. They are relieving that. That was the major thing that broke the health insurance, was the billing towards private doctors from government insurance, anything they could bill you with.
Well,
Do you know that either private insurance is existing or government insurance, such as Medicare, Medicaid, coast to coast, does not cover teeth? You go to a dentist and they either pull your teeth or give you dentures. They do not cover implants, dental crowns, and the ones that pay more on top of it in private insurance don't even get this, even including Cornell. They have to pay a more premium on top of it. So I was explaining that Medicaid was handing you a napkin while they're eating the hors d'oeuvre. So why are they putting Americans out there fighting one another on each other's who's going to pay for this or that or come up for one system? I do agree with Obama. He's got a lot of glitches to work out, but you just can't take away, like the Tea Party wants to be the conservative to the point where it's junk bond. Good government's good government on gross income on labor, where you pay into FICA, you get something out of it, you're stable. When you start taking, go ahead.
Yeah, with all due respect, though, okay, the Tea Party movement is in line with the conservative revolution of limited government, because government under Obama now is too big.
Okay.
Okay.
Government under Obama wasn't big. It was under the pre-existing leading up to this.
No, that's not true. That's not true.
I think Obama's done quite a great
job.
job.
Oh no, we
in
have
alleviating
a
lot of
much
problems
bigger,
like Gaddafi,
a much
the
bigger
banking.
government. Another side effect to Obamacare is that there's major privacy issues in there.
Okay, there's privacy
You register
issues,
for
yes.
those exchanges, you're going to be
But
forced
Will, just
to
the other day
give
you
them
said get rid
private
of food
information.
stamps, okay?
You're going to be
You
forced to
Go
give them
ahead.
private
You said get rid of welfare and
private
food stamps.
information.
This is going to encourage people to get a job, to pay the FICA, and live the royalties after. I mean, there's so little royalties now, but that's what we get. You can't take that away.
No, but this, there's major privacy issues in
Okay.
here. You're gonna be forced to tell them information like your social security, how much you make, and even if you've been incarcerated.
Well, wasn't that
And
supposedly
no,
recorded through
and
FICA?
even yeah, it's privacy issues, but even and they even want to know if you've been incarcerated. You know,
Yeah,
I'm
yeah,
like, what
I mean,
what does that have to do
incarceration
with
records, some
getting
are
health
sealed,
insurance?
but
They're
others
just
are exposed.
it's just
I
a
mean,
major big intrusion, you know,
Yeah.
on our lives. Government has gotten too big, and we need to do something about it.
Well, George Will knew this even before Barack took office, even before the vote. I mean, when George Bush pounds 8 years of military service down another country's throat,
Oh,
and
no,
they
no,
can't
no,
get
no,
the victim, and then a Barack goes back, takes the final victim out after all the money is spent, and then takes Gaddafi out because of the banking.
Wait a minute.
Somebody must be doing something
wait a
right
minute.
here.
Wait a minute. No.
That's what happened.
No. Okay.
What
with all
about,
due
what about the
respect,
veterans?
okay.
No after
With all due
duty pay
respect,
after
okay.
that.
You just labeled Osama bin Laden a victim. Okay. No, he's not a victim. Okay.
No,
He's the
I'm
guy.
saying
He's the guy that.
he's the one.
Look,
He's the one that they
okay.
wanted out of there. But Bush of 8 years
No, but
employment
listen,
in
listen,
Iraq.
we wouldn't have
did
gotten
not
bin
take
Laden.
Obama out of
We
there.
wouldn't have gotten bin Laden if it hadn't been for the operations already in play under Bush. Okay.
Then why
That-
was
that-
there so much
we
controversy
had those
over not
operations
taking
already in
and
play.
achieving his status out of there?
Huh?
Why was there so much controversy on not getting him under the Bush administration?
Oh no.
Why
They
did
were,
Rumsfeld, the head of security, say that we don't feel we can take him? He was like a
He never
two-sider.
said that.
He played both
He
sides.
never said that.
And Bush played. Yeah, he did.
No, he didn't.
Yeah, he did.
No, he didn't.
You can pull a tape out
No,
where
he
he said,
didn't,
"Well,
man.
we don't have ground."
He never said that.
And what about Gaddafi running with the drug money, running the banks?
Yeah, but
and then
with all
Bush
with
not
all due with all due
imposing
with all due
regulations.
respect,
Yeah.
the Obama administration supported Gaddafi before
Okay,
they ousted
I'm
him.
not going to hash over what happened,
Okay.
but that's a hell of a dent in a lot of financial dollars and cents we
No,
saw go out.
but the
for
deficit
death
went up.
and
The
destruction.
deficit went up, and government grew under Obama. Okay.
There was more
Government-
soldiers employed.
No,
more
government grew
reemployed
under
through
Obama.
George Bush.
Government, nope,
Obama
government.
came in and started.
Yeah, but Bush didn't grow the government. Bush grew the economy.
Obama is working on shortening the government.
No, he's not. No,
yes,
he's not.
He is.
He's expanded the government more
you
than
know what
tenfold.
Do
Okay.
you know the cost of gasoline, food, etc.?
Yeah,
when
dude,
you employ a
it's
union?
it's all increased under Obama. Okay.
Are we at war now, or are we deploying
We're still at war.
10,000 soldiers?
We're still at war.
We brought
We're still at
10,000
war with
soldiers
the
home.
terrorists. We're still
Now
at
they
war.
wanna know
He
what
didn't
they're gonna
end
get
the
after
terror
this.
war.
I
Obama
think you're
didn't end
blaming
the terror
Obama.
war. We're still fighting the terrorists.
I
Okay.
think you should
We're not.
should give
You-
Obama credit for
Oh.
not creating another deficit.
He did
More
create a
on
deficit.
to the
He
deficit.
increased the deficit.
on what
It's-
the government
No,
owes
he
on
increased
business
he
structures
increased the
such as
deficit
Social
more than tenfold.
Security
Now
and all
under
the
Obama,
labor.
the deficit is projected to be 22 trillion by 2016.
There's
Okay.
no projection.
Yes, there is.
Well,
The Congressional
with
Budget
what-
Office said that all the policies are
just
adding to
told
the
me you
deficit.
wanted to
We're going
shorten
to
government.
bankruptcy. We're
Obama
going to
brought
bankruptcy.
Iraq to a halt.
Nope. We're going
Yes,
to
he did.
bankruptcy. He
he
expanded the government, and we're going to bankruptcy.
Obama also
Okay? You
brought
need to
Gaddafi down
do your research.
just like that,
Okay?
without an army, without continuing the war machine on
No,
money.
we're
and
still
deficit.
fighting terrorism. He didn't end the war on terrorism.
Do you know the
We're still
deficit
fighting the
clock
terrorists.
started out 2 years into Bush?
The terrorists grew.
Do you know George
on-
Bush
the
made
terrorists
all
were
the money
able to
every
operate
time a
functionally
plane went
under
off,
Obama.
Bush was making money.
No,
Do you know they escalated the
No.
price of gas?
You're rambling. You're off topic.
To begin
You're
with,
rambling. You're
through
off
Goldman
topic.
Sachs
Okay?
Bank.
We need to get to another caller. All right. Thank you. Thank you. I appreciate your call. All right. But we need to get to another caller. But now. Right. Hello, you're on the air. What's on your political mind?
Hello, Will. This is William.
Yes.
Well,
yes, please.
I appreciate that previous speaker. He's a well speaking person. But But listen, as far as what you said that he did not stop the terror war.
Yeah.
Well, that is an absolute impossibility for anyone to do. Period. Because there are factors that are involved that no king, no president, no one single nation can possibly have control over. There are things prophetic. You said you were talking about things of prophecy. Well, I don't know what you were talking about, but I know that there's prophecy talking about in biblical things that's saying that there's going to be a battle of Armageddon, and it just looks like we're just heading for it. And there isn't any human way possible to stop it. And so there's no point in trying to pick one person and say this person's to blame, because Obama is in the saddle of a very wild bucking bronco. I mean, the United States of America is a very wild bucking bronco, and it's not now as far as trying to adjust and get the bills paid and stuff. Well, I certainly don't agree with any kind of this kind of government bearing down on people like that and getting all your personal identification. I don't believe that in itself will probably cause a civil war. But the fact is, any other president that was in there would have to do the same thing or something worse. So that's all I'm saying.
No.
So thank you very much for letting me view my thoughts.
Yep.
Thank you.
Yep. We get the right guy in there, and it will all work out. All right. But now we need to cut spending, before I take another call, I want to get into this because Kathleen Sebelius, or not Kathleen Sebelius, but the hold on one second. Okay, let me get into this. All right. Okay. The Secretary of Homeland Security is stepping down. All right. Janet Napolitano. Okay. And this is quite interesting. Okay. But I want you to take a look at this. All right. Here it is.
Looking back over the past 4.5 years, I can say that if there's one takeaway, one object lesson and core operating principle that I've learned and embraced as secretary, it's this. In a world of evolving threats, the key to our success is the ability to be flexible and agile.
Yeah. But anyhow, well, she's stepping down, and now that the government is up and running again, okay, Obama is now appointing someone else in her place. All right. So we may not default, okay, and the government's back and running again. But amongst the people that okay, this is the guy that he's appointing, okay, to be the health and to be the Department of Homeland Security secretary. Okay, now he's a general, okay, but out of all these people that were up for the running, New York Police Commissioner Ray Kelly was one of the people that might have been considered, but there's controversy over this guy. And there's controversy over this guy because he's part of the drone campaign and the Obama drone campaign over the drones. Okay, now I think I have time for just one more call. Otherwise, I'm going to put it down to the last words of the night. Okay, all right. Now, all right, no more calls. All right. Last word of the night, okay, which is, okay, all right, I have a good idea. Hey, caller, give me the last words of the night.
Hello.
Give me the last words of the night. You
Yes,
have
the last
you have
words,
three
well,
you have 3 minutes.
There's no possible way to
You have 1 minute.
yes,
1
there's
minute.
no possible way to adjust or to make a program where all of the medical industry, all the funds that's being spent by the medical industry can never be paid for, and and everything else can work out right. There's no human being that's going to be worthy to do that, or able to do that.
All right, my friend. Thank you. All right. And that is all the time we have on the show. I'd like to send a shout out to my very beautiful girlfriend, Lorana. I love you. We are the strongest couple in history. All right? But we thank you for watching Political Point Magazine. The right is right, and the left is always on the wrong side of history. Okay? Follow me on Twitter. Okay? And also, you can catch us on YouTube. Alright. Okay. Well, thank you for watching Political Points, where the right is right, and the left is always on the wrong side of history. Vote Republican. Check us out on the web, facebook.com/PetePolitical, myspace.com/politicalpoint. Email us at politicalpoint@hotmail.com, mccarpet24@hotmail.com, and check out my website on the Elmira City Hall Examiner. Once again, I blow a kiss to my beautiful girlfriend, Lorana. I love you.